This is the PA Startup Podcast, episode number 17. This is the PA Startup Podcast, where we help pre-PA students, current PA students, and new grads start their careers as physician assistants. I'm your host, Chris Darst. We are glad you're here. Hey guys, welcome back to another episode of the PA Startup Podcast. This is episode number 17, which is a day in the life of family practice. And my guest today is not your typical average PA who we might interview. He is also the owner and operator of thepalife.com and the Pance Panre review website called Smarty Pants, P-A-N-C-E. And he is the host of the, let me get the name right here, the Audio Pance Panre podcast. So he is a fellow podcaster. He is a fellow PA. He worked for over 10 years in family practice, and he also operates these other sites that are helping PAs across the country. So, you know, my hat is off to him. His name is Stephen Pasquini. Excellent guy. I really enjoyed this conversation today. So he was out at a conference in California, and we had a couple audio issues, so there's a couple parts in this interview that it crackles out a little bit. We're having some internet connectivity problems on Skype, but otherwise it was a very fun conversation, and I can't wait to have him back on the podcast. He has a pretty cool backstory. I don't want to give it away yet, but he used some government resources to help him get PA school paid for, which I will link in the show notes at pastartup.co/episode 17. So I'll let him tell you the details, but I will have the links to the show notes in there. But really cool guy, cool backstory, and man, he's been out there writing books and really just helping us PAs grow. I'm excited to be in his company, and I can't wait, like I said, to have him back on again. So here's my conversation with Stephen Pasquini of thepalife.com. And I will be back to fill in any gaps.
Yeah, so I went to PA school at UMDNJ, which is now Rutgers in New Jersey, and I'm from Stockton, California, and then went to undergrad actually in Seattle, and I had applied to, I think I applied to 4 or 5 schools, and not expecting to go to New Jersey by any means, right? But and I thought, gosh, New Jersey, what's going to be like in Jersey? I think it's cement and concrete. But went out there, it was just a beautiful, beautiful school. And when I was in undergrad, I really was, like many people probably, with the intention of going to medical school. And that's because in 1995, when I was in undergrad, I had never met a PA before. And in fact, I didn't even know the profession existed. And I think I was probably my sophomore year in school, and then I met with my guidance counselor at the time, who told me, very kindly or not so subtly, that med school probably wasn't going to be on my horizon. So I had some inner conflict going on, but at the time I was working in the Hall Health community health, Hall Health. It was the campus health clinic. And I was medical records, so I was delivering records all around the clinic. That's in the days where you still had paper records.
Oh yeah.
And you might remember that too, because. And I kept going down to the ortho department, and there was a gentleman down there who was really nice. And finally, one time, I don't know how we started talking, and he told me that he was a PA, and I said, well, what's that? What's a PA? And he was always working by himself, doing cool procedures, and he seemed like a great guy. And that's when I learned about the PA profession, and that really was a change in my life, because I found there might be a path for me to medicine, and actually I think one that I knew was probably a much better fit in what I wanted to do long term. So
yeah. Do you have any medical people in your family?
I don't. No, both my parents are school teachers.
Yeah.
My dad taught for 35 years, my mom too, so they were very disappointed. They kept telling me that when I get summers off. So.
Yeah, they're like, oh, you made a wrong choice, man. You're going to work 12 months a year.
They still wonder what I was thinking, but
That's cool. That's cool. So went through school, and what was your goal? Was it ortho because you had a good experience, or were you looking for something different?
No, I knew I wanted to go into primary practice, and actually I'd heard about the National Health Service Corps, I think probably my junior or senior year in college when I was at University of Washington. So I really knew that I wanted to work in underserved communities, and I really had a passion to serve in that area. So I really knew that's the plan that I wanted moving forward. And then when I got to Rutgers, I did my first year, and I actually applied through to the National Service Corps, and I wasn't accepted. And Rutgers is a 3-year program, so after the second year, I applied again, and then I did get the scholarship program, which was wonderful because they gave me a stipend. I got $1,000 a month, and then, upon graduation, I just, I'd be placed in a community that I knew that I wanted to work in.
That's really cool.
So
For the audience, I don't know, we haven't really talked about that. Can you talk about the Service Corps a little bit and just kind of what it's for and how it's structured and how to even apply for it?
yes, so I'm a huge fan of the National Service Corps. There's really two paths to National Service Corps. There's a scholarship program which you apply to while you're in school or right before you go into school, and that gives you a stipend, and then you serve in an area that is based on a health service need. I can't remember what it's called exactly, but it's like an HSA, I think. So when I was in, actually, there was such a need everywhere that they didn't even have a score system. So I could apply to a job really anywhere in the country. Now it's a little different. So if you get out, you might have to go to, certain areas based on where the need is most. The other path is through loan repayment. And that's actually majority of people go in through this route. And at the site that I ended up working in, actually, we had three PAs and NPs who were there on loan repayment program. So that's another path too. And they pay back your loans. I can't remember what the limit is now. I think it's maybe $50,000 and per year. I'd have to look it up again, but that's a great route as well.
Okay, cool. Yeah, I think we had one international student in our class who was waiting for his kind of acceptance letter, and if he didn't get it, he was gonna leave. And so I think it was maybe the first or second day of class. It was pretty cool to see him, like, they delivered it to school during class, and he got to open it, and he was like, "Hey, finally, it's paid for, and we're good." And so it was pretty cool. But cool. Well, thanks. I'll put a link to that in the show notes for any listeners out there that are interested in that to help pay for school or loan repayment, stuff like that. So yeah, look for that there. But so upon graduation, you go into family practice, primary care. Tell me, what was that like? As a new grad, did you feel like I got this, or were you like, oh, I still have quite a bit of learning to do?
I was petrified. Yeah, it was very. And to top it off, so I went to a community that about 83% of my patients spoke Spanish, and I did not speak Spanish at the time. My family's Italian, so I came out for a job interview in this very rural town in Northern California, and they were a National Service Corps site, so I flew all the way out, actually, and I get there, and they decide that I guess they don't have a space for a National Service Corps grad, so I was kind of like, what do I do now? So I looked on the list, and there was an interview place kind of about, I'd say, 3 hours from my hometown down south, and I interviewed there, and that was it's a rural health clinic. It's a farming community, and it was really the perfect job. But yeah, 83% of my patients spoke Spanish. I did not speak Spanish, and going in there, it was a lot of. I was the only provider at our clinic at the time on weekends, so I was working solo, and yeah, it was a pretty challenging situation, but a very, very rewarding and wonderful one.
Wow. How did you work through that? Not speaking Spanish, or having maybe limited medical Spanish. How did you work through that to be able to communicate with people?
I actually bought the Michelle Thomas Spanish learning tapes. I listened to them in the car.
And it worked. It worked.
And it worked. Yeah. Well, and what's amazing about the situation is when you can use it on a daily basis is you can really start to practice. And, Spanish, I'd taken Spanish in high school for a year. So I had some, but, I just wasn't that interested, and I didn't really have the chance to practice it. So when I was there practicing every day, then I could pick it up. So that, and then I had a wonderful medical assistant who worked with me and, would correct me on words. And after about a year, I was kind of able to get my footing through it. But
wow.
Yeah.
Wow. That's so you not only had the challenge of being a new grad, working solo in a practice that you're not, book smarts and actual practice are different, but you also had the language barrier to overcome. That's intense.
Yes.
Wow.
Looking back at it now, it doesn't seem like it, but I remember at the time, I think a lot of people, I think I guess some people feel ready when they graduate, and I had a great education. I mean, I really did, but I still didn't. I was just really nervous, starting out, and I was just really worried about hurting somebody or
Yeah.
missing a diagnosis. But after a few days, you start to kind of get the hang of it, and then but it takes, I don't know about you, Chris, but I know for me, probably 2 years to where I felt really, really comfortable in what I was doing.
Yeah, it was. I had like a little honeymoon period of like 2 weeks, and I think it was probably before I had privileges, so I couldn't do
Yeah.
anything. So I'm watching, and shadowing basically, and I'm like, I can do this, I can do this. And the first time somebody was like, hey, this guy needs a CT scan, and that was back in the days of handwriting orders. I was like, do I just write CT scan? And they're like, well, no, you have to, like, what part of the body? And I was like, chest? I don't know what like, it was so foreign. It was like I forgot everything from rotations, with and without contrast, PO, IV, all these things that I was completely blindsided. And so then I spent, honestly, 6 to 9 months just scrambling, and studying at night and things like that. And then it became, I didn't feel comfortable. I'm with you. It was probably 2 years before I felt comfortable with a lot of things. And then I switched jobs. So I went from general surgery to cardiac, and all of a sudden now the cases are different, and the physiology is different, and everything was. So then it was another year on top of that. But so tell me, take me through. I know you probably didn't have a typical day in family practice, but for someone who's interested in family practice, what should they expect from a typical day working as a family practice provider?
I think it probably depends to some degree where you work too. At my particular clinic, we saw the whole gamut, and it was a combination of both family practice and urgent care. So we took walk-ins as well. So I'd come into the clinic at 8 a.m. and I worked 10-hour shifts there actually. So I'd come in at 8, and I'd have scheduled patients throughout the day, and there'd be about, I think we had patients scheduled every 20 minutes. So we'd start seeing everything from child checks to women's health exams to physicals to you name it, to basic, scheduled appointments for UTIs, URIs, the whole gamut of things you'd see. And then we'd have walk-ins come in too, which was really challenging because you could get anything. And, sometimes you'd have a walk-in scheduled in the middle of a pretty booked schedule, and that could really, really throw you off too, as far as, keeping pace. But we did a lot of pediatrics at my clinic, so I had a lot of pediatric care and just about everything you could imagine when it comes to family practice. I think a lot of it was basic things like upper respiratory tract infections. We saw a lot of cough and colds, asthma, allergies, lots of diabetes in our clinic. So we did a lot of diabetic care, insulin management. And then everything you get in urgent care, like suturing, broken body parts.
Yeah.
So it's wonderful because there's a lot of variability, and you get to be very creative. So you get to use your mind and create treatment plans. And we had a very collaborative environment when I started. We had a pediatrician who worked there at the clinic. We had a OBGYN. We had a hospital that was about 30 minutes down the road, even though we were in a rural area. So we had places we could refer to. We didn't have very good psychiatric services available to us, so that was always hard, making referrals. It was challenging to get basic things like medications for our patients, just because a lot of them didn't have health insurance, didn't have transportation. And that was a very challenging thing too. But
could you give out? Oh, sorry. I was going to say, could you give out
Yeah.
samples and things like that for people, or was it not called on frequently by the drug rep community?
Well, it's funny you ask this. So when I started, actually, we had a cabinet of medications that we would collect from patients when they didn't need them. And we would actually stick the medicines in the cabinet, and then we would give them out to patients who didn't have medications.
What?
And I probably shouldn't be saying this on the air right now, but
did I say California? I meant Ohio. It was in Ohio. So yeah.
I know it's hard to believe, but the doctor I worked with, that's how hard it was to get medications. Now I think we stopped that practice probably about 5 or 6 years into it, but but that's just what he would do. And actually, this doctor, his dad was a doctor, and he'd worked in frontier medicine for years. So that's just, you just did what you could do to get patients medications.
Yeah,
So
yeah, and
I always laugh when,
honestly, that's better than nothing. I mean, if you've got you're making it work, and that's where the creativity part comes in. That if you've got to put the metformin in the cupboard, and you come in once a day, and we'll give you your twice a day, we'll give you your dose. Maybe that's what's got to happen. So that's pretty cool. That's pretty cool.
when it's metformin, right? That's I think what we were probably hoping.
Yeah, yeah. You're like, well, it looks similar. Sure. If you get lightheaded, maybe it was a beta blocker, but yeah, just let us know.
Something else, right? Yeah.
Yeah, that's funny. What were your hours like in family practice?
I worked 10-hour shifts, so I'd work from 8 to 7, I guess, and then we'd have an hour lunch break in between, and 4 days a week. So it was nice actually, because I haven't worked a full week schedule for so long that I don't even know if I could go back to working 5 days a week.
Yeah.
And it was nice for having the long shifts and have 3 days off. So and I did work weekends when I started, so not every weekend, but I think I worked 2 weekends a month. So we split it off with the other PAs. But I didn't have to do call, which is wonderful. I know in surgery, and I don't know if you have to do call, Chris, but it's something that I really like not having to do.
Yeah.
But yeah, so the hours are very, very predictable, I guess is the word I'm looking for.
So then your 4 10-hour shifts a week, did that include the weekends? So if you worked Saturday, Sunday, then you basically filled in on either end of the weekend to make 4 10s?
Exactly.
Okay.
Yeah.
That's great. Are they hiring right now? Because no, I'm just kidding. I don't speak Spanish, and no, I'm kind of ingrained in where I'm at. But that sounds great. 4 10s would be all right. So
I still have those tapes for you, Chris.
Yes.
You need them,
yeah, and let me know which is which in the cabinet, so I know what to prescribe. That'd be great. Very good. What was your favorite part of family medicine?
You just get to know the whole family. So, after I was there for 10 years. So by the time I'd been there, I'd seen the first child, and then, the mom of that child, and then the, grandma, and the whole entire family. So it was wonderful, because you really became part of the family. And I think that's the best part of family practice, especially if you can be in a clinic like this. Small communities are wonderful, because, we'd get invited to to people's homes, and, it wasn't uncommon for people to bring us just huge meals of pozole and, amazing Mexican food. So that's just something that you can't get in every specialty, I don't think, is just being part of people's families from really cradle to grave.
Yeah. That's a big spectrum. How about procedures and things? You had mentioned, suturing and stuff like that, but did you do any other procedures like, lumpectomies, or not lumpectomies, but like lipoma removals, or I'm sure you had the toenail removal, ingrown toenails and stuff like that. Did you get to do a lot of procedures, or was it more kind of the urgent care suturing type stuff?
Well, I think my olfactory senses don't work anymore because of a lot of INDs. We did a lot of those. I think I blocked that sense out of my nose.
Good for you. Good. That is a necessary trait sometimes.
We would do basic splinting, like I said, lots of suturing, lots of stapling of heads, in kids, a lot of those. Lots of INDs, some basic biopsies, for dermatological lesions. Trying to think of anything else. Eye exams, so you would do fluorescein staining. Yeah, I mean that's kind of the spectrum. Injections, do some joint injections, trigger point injections, things like that.
Okay.
We would do in office as well.
Yeah, no vasectomies in the back room or anything.
Well, prostate exams, women's health exams. So you're doing health exams. Trying to think of anything else, that we do. Probably some other things in there too that I'm not thinking of now.
Yeah,
but
that's definitely a broad spectrum, which is great. I mean, that variety is, I think, what keeps people excited about it, is that you do never know what you're going to get, so you'd have to be on your toes and things like that. Whereas some surgical fields where I could tell you every heart is different, but it's similar enough that you're doing the same kind of repetitive cases as time goes on. But Well, good. What surprised you as you graduated and even as you worked? Did anything surprise you over the years about how your job changed or the responsibilities that you got as a PA that you didn't expect?
I'm surprised how much I work alone. I mean, I work solo a lot. I don't think I knew that, in school. I don't mind it. I actually sometimes like it, but I didn't. I guess that surprised me. Um, Insurance, I think you don't not really know what you're going to be up against, and how much that dictates how we provide care to our patients, or lack of care to our patients. So that's something that bothers me, and that I think maybe I knew about, but not to the degree that once you start practicing.
Yeah, for sure. Any crazy patient story that pops to the top of your mind? I like to ask people because there's always at least one where you're like, "Oh, we had this one." But anything that jumps out at you that you could share that's HIPAA compliant?
It doesn't involve. One comes to mind actually, and it was when I was a student, believe it or not, and I was on my general surgery rotation, and my attending at the time's name was Dr. Dick, and he lived up to that name. Very demanding man. But I was with the resident at the time. We were scrubbing, we were preparing the patient for the surgery, and he'd asked me to remove the hair from the patient. So, he kind of showed me how to grab the tape, and so I put the tape all over his general area and get it all prepped. And then I go to remove the hair, and he's standing across from me on the table. So I grab the tape and I pull it up, and I guess I did it the wrong way. I threw the pelvic hair all over his face. And
Oh no!
So I got put on decubitus ulcer clean for a week for that.
No way. That is.
So I guess a piece of advice is just remove the tape, towards you and not your resident.
That's right. That's right. It's let's see. If I'm draining boiling water, I do it away from me. But if I'm removing body hair, it's towards me. All right, I got it. That's pretty good. Well, what advice would you give either yourself or anyone else if you could go back in time to the Stephen who's applying to PA school? What advice would you give that person to help them get through school?
It's going to sound kind of cliche, but just believe in yourself, because I think, I actually had this advisor in school, and I think, it was really discouraging for me, and they didn't give me a lot of outlets or ways to, to kind of redirect my passion, because I knew I wanted to go into medicine. And it was really tough for me when I had this moment where I thought that might not be something that I could do. So I really struggled with having confidence that I could do that and do this. So, I wish I could go back and tell myself it was going to be okay, and that, I get there. I probably spent a lot of time worrying. So, maybe not worry so much.
Yeah.
Also take, every opportunity you have to do things, and don't be afraid of messing up. I think sometimes we let opportunities go by because we're afraid of what will happen, or, how our voices all sound on a podcast. But I think gotta take just take those opportunities and put yourself out there.
Yeah. Awesome. Well, very good. Well, I won't keep any longer. I know you're a busy guy, and I try to keep these around 30 minutes or so. About then, people are either at their destination, or they're done with the treadmill, or they're just tired of hearing my voice. So, yeah. So thanks for your time. And if people want to find you, so I included this in the intro, but for people out there that want to find you, you're a busy guy. You've got a lot of different areas that you are working on. So where can people find you and your information?
Probably the best place is through my website at thepalife.com, and you can just contact me through the contact form there. I try to get back to everybody as well as I can. Sometimes it takes me longer than I hope. There, or at smartypants.com too, on my board review site. I have a contact form there too. You can always reach out to me for anything. I'm always love helping, like you, Chris, and anybody that we can help them either find our profession or find the path there. I always want to help. So
Cool. And then do you also do a board review podcast too?
I do. Yeah, it's called the Audio Pance Panre.
Okay.
Board review podcast. Yeah. So you can find me there as well.
That's right. You're in a lot of
for
places.
10 amazing questions.
That's great. That's great. Well, good for you.
Yeah.
Well, I will link all that up in the show notes so people can find you. But again, thanks for your time. I appreciate it very much. We had some audio issues right there at the end, so I didn't mean to stop that abruptly, but the Wi-Fi went out either on my end or his end, and we couldn't reconnect, so called it good there. But we will definitely have him back on the show. That was my conversation with Stephen Pasquini, family practice, day in the life of PA, but also the owner and operator of the PALife.com and SmartyPants.com. And the Pance Panre review podcast. What a great guy. Just very natural. I hope I come across that natural because he was a pro. So I really enjoyed talking to him, Stephen. If you're out there listening, thank you so much. But yeah, that's I've got all the links that he was talking about in the show notes. I've got links to his site, thepalife.com. He is also the founder, like I said, of Smarty Pants, smartypants.com, which is an excellent review course for those of you who are out there either about to take the PANCE exam or recertify. I will be using that this year to recertify once again. He also runs the Pance Panre Academy through his website. He's authored 2 essay books for pre-PA applicants, and he offers mock PA school interviews. So great guy, great resources out there. Links to the National Health Service Corps, both the loan repayment program and the scholarship program are in there. So if you are considering PA school, are not sure how you're going to pay for it, definitely check this out. The links are at pastartup.co/episode 17. And as always, you can hit us up on Twitter, pastartup.co. I'd love to hear from you on Twitter. If you leave a rating and review for the podcast, it helps other people find us, helps us show up a little bit better in iTunes, and definitely hit us up for a review. Give us 5 stars if you would. Funny story, my daughter is 13, and she just discovered the podcast app on her phone, so I showed her mine, and she said, "Oh, I'm going to review it." And I was like, don't worry about it. You haven't listened to it. I want them to be authentic reviews. And so the next day she came up to me and she said, "Hey, listen, I gave you a review." And I was like, "Oh, thanks. I appreciate that." She goes, "Yeah, I couldn't figure out how to give it 5 stars, so I just gave it 4. And I said, "You are my only 4-star rating now." So anyways, I would love it if you just hit those stars. You don't even have to leave a comment if you don't want, but the more ratings and reviews we get, the more we can get discovered on iTunes, and just I would appreciate the love. If you get a chance and you are a pre-PA student, I would love for you to hit up the website, pastartup.co. We have a tip sheet for writing your PA school application essay, as well as a workbook if you're having trouble getting started. We've got an affordably priced workbook there as well. So check that out. That'll kind of segue into next week's episode, which is all about pre-PA students and what the applications committee is looking for. So check us out there. Again, check out the show notes. Show Stephen some love over at PALife.com and SmartyPants.com. And guys, you're just so great. I love your emails. Keep those emails coming to questions@pastartup.co. And if you don't want them read on the next Q&A episode, just put that in the email itself. But I've gotten some great questions from all over. I've gotten some from Canada, gotten some from United States, gotten some from Great Britain. Really cool. I never know where you guys are. So hit me up with any questions. I will absolutely do what I can to help you on your journey wherever you're at, whether it's pre-PA, current PA, or new grad. Thanks for listening, guys. I will catch you next week, episode 18, where we talk to Mike Huckabee, the program director at Mayo Clinic, about what the applications committee is looking for in a pre-PA applicant. All right, we'll catch you next time. Have a great week.
I mean, absolutely. I'm honored to even be on here, so I appreciate it.
Well, my mom will love listening to it. So,
At least your mom listens to yours, right?